Now in BetterHealth, we find out about the Early Discharge and Rehabilitation Service for older people, formerly known as the Gibson Service.
Well, my name's Helen Murphy and I'm the unit manager for the Early Discharge and Rehabilitation Service for the older people and also for the under 65 Rehabilitation Service at ISIS. This service provides an early supported discharge service which takes patients out of Dunedin Public Hospital earlier than would normally be expected by providing them with support, and this also is a service which provides community rehabilitation for over 65s living in the community.
My name is Michelle Keating. I'm a registered nurse with the Early Supported Discharge Service with Southern DHB. We get a lot of referrals from the hospital to go and assess patients who are in hospital who are in many ways ready to go home, but there may be some things still going on that would benefit from our input. So we tend to go and see them on the ward, decide whether or not it's safe for us to accept them.
My name's Kate Frame and I'm a registered nurse who works here on 6B, which is Older People's Health in Dunedin Hospital, and part of my role is a day-to-day cares with patients, being an advocate for the patients and anything else that they may need. Okay, so we have a criteria that we go through, so they've got to meet the criteria. If they do meet the criteria, then we would give them a wee phone call over in the ESD service, and we would talk to them about the patient and if they were also accept them or had room on their books. And if it was all go, then we'd send a paper referral through via fax, and they would then come over and see the patient on the ward and give us a thumbs up.
And if we do, any one of our team can go in on a first day visit and make an initial safety check at home and plan any care that they need from there. If any member of the team picks up a need that they think a nurse might be more appropriate to go and deal with, then they can come and ask us to do that. But often things that we do tend to get quite involved with are people's medications. Sometimes there's been a change in that while they've been in hospital and they need a bit of help to learn about how to deal with a new medication regime. They often have a number of chronic conditions or things going on that need some close monitoring. So we keep a pretty good eye on them for maybe the first 3 to 5 days after they go home. We can liaise back in with health services at the hospital or out in primary care if we pick up on problems and need more input than our team can provide.
I'm Rose Dale, and I'm an occupational therapist with the team. There's 2 of us on the team, Jenny and myself. We work, well, basically the same as everyone else on the team for early supported discharge, and that's helping people getting home from hospital. Sometimes that involves taking them home, making sure that they're all set up with what they need, they've got their food and they can get in and out of the house. With the occupational therapy side of it is that if they do have issues with getting on and off things at home, like their bed, their chair, in and out of the shower or things like that, that we can provide some equipment from there just to make sure that they're safe at home.
Lots of basic things, so we check that they can wash and dress themselves, and if they can't, we need to set up services that get people into the house to do that for them. We like to make sure that they know what medicines they should be taking and when, what to do if they start to feel more unwell, and just generally have a look at their home environment and see if there's anything that we can do to kind of make them safe to stay at home or prevent the need for a readmission.
Some elderly patients prefer to be at home rather than to be a long time in hospital, so it's good for those specific patients.
If they're keen to get home anyway, home's always the best place. Their bed is always better.
The patient needs to be medically stable, and we do have some discharge criteria. They need to be actually leaving the hospital before that they usually would, and they need to want to go home.
But it's also important to realise for the folks that aren't necessarily going to be able to look after themselves in any way that we put packages of care in so that it would be easy to pick up on the folks that perhaps aren't managing.
And it is about that being in their own environment, but still feeling they need that support, you know, from people at the hospital. So when we can come in and see them, it helps them with their confidence and definitely makes them feel better. And we get lots of positive feedback.
A lot of patients prefer rehabilitation in the home area and getting home sooner out of hospital, so it's a great service.
I think there's a definite need for the service, that there are a lot of folks that are keen to get out of hospital and frustrated by the reasons that perhaps stop that, and they often tend to be things that we can do something about. So a lot of success stories.
We have a team of nurses and therapists that complement each other, so and rehabilitation assistants, so we are able to really give a very holistic service for these patients. There's a lot of research gone into the viability of them and the effectiveness of them, and it is very well documented that they are a good way of supporting and getting people out of hospital early.
So the benefits of this early discharge and rehabilitation service go beyond reducing bed days for this group and improving patient flow. And hey, it's much nicer to be in your own home.